Okay, so today we are discussing pre-eclampsia, which is a very important topic because it's a common hypertensive condition affecting our mothers, be it prior to delivery or indeed after delivery. I think all of us have come across pre-eclampsia in one or the other. So I will not spend much time writing notes on the board because the notes are already there. It's just a question of extracting the notes and distributing them accordingly. But I will instead give you an outline of what we will present. So we will look at hypertensive disorders in general, basically the classification of hypertension in general when it comes to pregnancy. So that's the first thing that I'll talk about. Then the second thing is I will narrow down on pre-eclampsia. And when we narrow down on pre-eclampsia as exemplified by the notes, we shall look at the definition. Then we shall look at pathophysiology, which is on the board. Then from there we will look at risk factors to pre-eclampsia. After we talk about risk factors, we will then look at symptoms, signs, differentials. Then we will go down to complications of pre-eclampsia, which could be maternal or fetal. After we finish talking about the complications, we shall then look at classification of pre-eclampsia as to what makes mild and what makes severe pre-eclampsia. And then we'll close in by looking at the principles of management of pre-eclampsia. But I should be quick to mention that within the pathophysiology of pre-eclampsia, we shall look at prediction and prevention of pre-eclampsia. I think that's something that is quite good, because if we can predict that this woman will have pre-eclampsia in the next 4 weeks, then chances that we can prevent it is very high. And that's the direction in which we should be moving, instead of always firefighting. No, I'm referring a pre-eclamptic patient who is 28 weeks. I mean, the problem has already occurred. You can't reverse it. And so you have to face the consequences, as it were. Okay, so having given you an outline, I will narrow down to the first subtopic, which is hypertension in pregnancy. How do we classify hypertension in pregnancy? So we basically have, I would call, 3 broad categories of hypertension in pregnancy. The first category is gestational hypertension. The second category is chronic hypertension. And the last one is the pre-eclampsia. Not gestational, but narrowing down to pre-eclampsia, superimposed on chronic hypertension. So we've talked about gestational, we've talked about chronic, and we've talked about pre-eclampsia superimposed on chronic hypertension. Now, why are we calling it gestational hypertension? It is similar to gestational diabetes mellitus. It is a form of hypertension which only comes in pregnancy and usually resolves after one delivers. Remember the difference between chronic diabetes or vet diabetes versus gestational? One just came in pregnancy. No wonder when you deliver, like the mother that we had, we stopped the insulin immediately, despite having given her high doses of insulin. But we know that that condition was to do with pregnancy, so we stopped. So it's similar to gestational hypertension. And within gestational hypertension, we've got 2 types. We've got pre-eclampsia and the PIH. Pre-eclampsia means the blood pressure is high and there's significant protein in urine. Whereas in PIH, there is high blood pressure, but there is no significant protein in urine. Clear? So that is it, basically gestation.
Maybe excused.
Okay.